I wanted to chat just for a couple minutes about the business case of why Medicaid expansion is so important for Missouri and for all businesses throughout the state. One, the most simple part about this is there's $2.2 billion per year that can be injected into the state's economy. And regardless what you think about economic theory and et cetera, government spending, et cetera, that's simply $2.2 billion that will not be in our state's economy if we do not expand Medicaid. That's a very important distinction. Two, most of this, by the way, Senator Bond has already mentioned, but our tax dollars are going to Washington, D.C. to pay for the Affordable Care Act one way or the other. And we're a lot better off having those dollars be brought back to Missouri, not being spent in Iowa and Illinois and Arkansas and Kentucky, and bringing our dollars home to help our state and our economy. Another thing, we talk about hospitals losing payments to help deal with and allay costs from uninsured patients that they have that they're caring for. And sick people aren't going away. These folks are still going to be sick. They're still going to show up in emergency departments across the state, and somehow those costs have to be borne. Unfortunately, the likely result without Medicaid expansion is that these costs will be shifted from hospitals to employers who provide insurance for their employees or the privately insured themselves. Medicaid expansion will help keep that burden off the backs of businesses and individuals, and which is obviously quite a benefit for the state and for our members and you all. In addition to the moral aspect of adding 300,000 people to health insurance rolls throughout the state, from a business perspective, you think about how many days and man hours are lost by sick folks not being able to come to work. And this is a lot of this it comes from lack of preventative care. So we have Medicaid expansion, more health insurance for 300,000 more people. This is the working poor for the most part. These are not people that aren't working or aren't doing anything. These are mostly the working poor. They can get more preventive care. They're more likely to be effective, be on the job, and working and helping contribute to the economy and the state's well-being. There's a women's health aspect to this as well. If we do Medicaid expansion, we're going to lose there's going to be approximately 4,000 mammograms that won't happen, 14,000 pap smears that won't happen. Not only is this very important from the standpoint of saving lives and the preventive care aspect, but it is also, again, helps from the preventive standpoint, helps catch these diseases early, helps people later on. Big benefit to the state. In addition to the women's health aspect is the mental health aspect. You talk to any law enforcement people around the state, anybody, they will tell you they spend so much time dealing with those that are either have mental health issues or are dealing with substance abuse issues. Expanding Medicaid will allow for a lot of services to be provided to these folks, will hopefully prevent these situations from ever happening. It'll save the counties, the states, the cities a lot of money from that standpoint, plus will ease up man hours for law enforcement to chase those that they really need to be chasing. Senator Bond mentioned also that there is likely not expanding Medicaid is likely to start building a healthcare desert across the state. A lot of rural hospitals not only are the primary economic driver for the area and the biggest employer, but if we have to shut these hospitals down, or if they're not getting enough, they're losing the federal payments, we don't have Medicaid expansion, they're bearing these costs for the uninsured, and they shut down or they have to reduce services. Not only, like I said, are we losing economic benefit from that, but we're also losing the health benefit. I mean, grandma has a heart attack, she's got to go 150 miles to a hospital. That's not a good outcome in any way, shape, or form. In addition to that is the brain drain that comes along with it. The systems, the 4 states bordering Missouri that are expanding Medicaid, Iowa, Kentucky, Illinois, and Arkansas, their hospital systems will have an influx of more money from Medicaid expansion that won't be seen in Missouri. We're already lacking in primary care physicians and healthcare providers. This is just opens the spigot for these folks to be coached away to these other states that border us. We need those healthcare providers, and we need to keep them in Missouri. Finally, Jackson Hewitt has estimated that employer penalties under the Affordable Care Act, that if we don't expand Medicaid, will range somewhere between $30 and $45 million per year. That hits all of our folks, that hits you all directly in the pocketbook. All can be eased by just simply expanding Medicaid. And lastly, as Senator Bond mentioned, this will not cost the state any money. Projections are that if we expand Medicaid by shifting some current population folks from what is now a 60% to 40% federal state match to 100%, 100% and then a 90-10 in the future match, we will save the state about $80 million this year, and with increasing up to $120 million next year and beyond. So there's a lot of business reasons that we need to expand Medicaid, and like Senator Bond said, we really encourage you to go talk to your legislators, call them directly and say, we need to do this. I'm a business, I'm an employer. This is how we need to keep our economy strong and keep Missouri strong.